Greetings from Human Biological Institute. Welcome to yet another engaging session of our scientific forum, Immunization Conclave. At Human Biological Institute HBI, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about vaccine preventable diseases and the importance of timely vaccination. These sessions feature leading experts from across the country who share their valuable insights on key health topics, aim to raise awareness and promote IL was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit and later registered as a company in 1999 with the name of Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first varicose culture rabies vaccine in the year 2000. Subsequently, HBI launched other vaccines and currently is a major player in the human vaccine segment. HBI is a leader in anti-rabies vaccine segment and present in around 60 countries. HBI has got three state-of-the-art manufacturing facility at Ooty, Gachibowli, and Karakapatla, which is at Genome Valley. With the vision of shaping global healthcare by spearheading One Health initiative, with the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives, HBI believe in providing affordable products with high quality through continuous technological innovations and improvements to meet customer needs. IELTS corporate social responsibility. IELTS has adopted two government schools in the vicinity of Hyderabad in Telangana. IELTS is providing infrastructure and basic facilities, including the midday meals program. With coordination with National Dairy Development Board, with a program of gift a milk program, over 2,500 school-going children from Telangana and Tamil Nadu are getting benefited. I also donated oxygen generation plant to Telangana Institute of Medical Sciences teams Gachibowli. These are few key highlights of Human Biological Institute, a division of Indian Immunologicals Limited. To know more, visit the website www.indimmune.com and follow us in the social media channels. Immunize with Pride is one of our unique initiatives which emphasizes that vaccination not only protects individuals but also strengthens community well-being. Uh, so all of you, welcome today's episode, that is Immunization Conclave. The session is dedicated to highlight the key significant topic for today's discussion, which is vaccinate and prevent hepatitis A protection for all age groups. It is my pleasure to introduce Dr. Mrutunjay Das. Professor Dr. Mrutunjay Das is a highly respected pediatrician and vaccinology expert from Bhubaneswar, Odisha, with distinguished contributions to child health, academic, and immunization. Known for his clinical expertise and commitment to preventive pediatrics, he has been a trusted voice in advancing child health care. He completed his MD in pediatrics and is a FIAP with certifications from IAP, ICP, Vaccinology, and APGNP, PN from Boston University, USA, reflecting his strong academic and global perspective in pediatric medicine and immunization. He currently serves as a professor of Department of Pediatrics at IMS and Sam Hospital and is associated with Neve Child Care at a dedicated neonatology and a child healthcare unit at Bhubaneswar. With his deep expertise in pediatrics and vaccinology, Dr. Das has been actively contributing to child health awareness and strengthening immunization practices. Welcome, Dr. Mrutunjay. It is truly a privilege to have you with us today. Welcome, Doctor.
Thank you. Good morning. Good morning, all the members, all the delegates, those who are watching. And thank you, IIL, for giving this opportunity to me. Actually, this is a privilege for me to be there with IIL, who is the
Welcome, Doctor.
pioneer in the vaccinology or in the vaccine manufacturing in our. Am I audible? Am I audible? Good morning. Am I audible?
Well,
Good morning. Good morning.
actually, there was a connection issue.
Actually, the network
Yeah,
is a little bit unstable in the mobile. Network
yeah.
is a little bit unstable in the mobile. So let's go
No
ahead with
issue.
the.
Yes, yes. So, hepatitis A, doctor, is a highly contagious, preventable liver infection that spreads through contaminated food, water, and close contact. While it can affect anyone, vaccination adults and high risk groups.
Oh,
Today, we have a very important discussion. So, for all the viewers, doctor, can you enlighten us, the viewers, that what is hepatitis A and why should it be seen as a preventable disease across all age groups?
the vaccine which is since many long days course, and we know the how it transmits. So there are the way of transmission, then the development of the vaccine would have been there in the market, and also it is and also the source is the contamination says food. These things are important for us. So if you take care of these three things, then public health program and we can improve the condition of the children, then that can be prevented. And also there is a well-known vaccine which can also protect the children from getting hepatitis A.
Doctor, is it a very highly contagious disease? How is it actually spreads? Like from other hepatitis, how do you see
Yes.
hepatitis A as a different kind of virus?
Yes, it is. It is actually causes little bit of epidemic-like features. It is highly contagious. The incubation period is almost, I can say, 14 days to 45 days. But the most important part is that it spreads very rapidly in the community if there is a source control is not being done. So if the source is contaminated, supposing the water, the food, the hygienic part, then the community will be affected very rapidly, and many of them also go to the rapid hepatic failure, causing fulminant hepatic failure. So we need to take care of this part, that this is a condition which can be prevented by a very well-known vaccine in our country, and lot of companies are already there in the vaccine, and Indian Immunological Limited is having a very good vaccine against hepatitis A, and we can protect our child from those type of conditions. So it is a very contagious disease, can be protected by vaccine and simple methods of taking care of hygiene.
Doctor, how serious this hepatitis A you feel? Because what we are seeing,
Yes.
as per the studies, it is getting severe. Previously, it
Already,
was not.
already I have told that this is a condition hepatitis A. Normally it resolves. Normally it resolves within 2 to 4 weeks. But what happens in few conditions, it aggravates. Supposing there is a background liver disease, and if hepatitis A supersedes on it, then it can cause liver failure. And if sometimes without any disease also, it can cause fulminant hepatic failure, which is a dead end liver disease. Very serious conditions. The child usually succumb to that. So a very fatal condition is the fulminant hepatic failure. And many of the condition they also leading to some extrahepatic manifestation in the form of some type of some may develop some type of abdominal pain, some type of gastritis like pictures. So permanent hepatic failure should be prevented at any cost for this from hepatitis A.
So as we know, doctor, it's what we understand is this is a main cause of fulminant acute liver failure in India, hepatitis A. So is that true in sense or
Yes,
yeah?
of
Okay.
course. It is 1 to 2% though, but it is one that 1 to 2% is a very large number for our population. So if somebody is happening, somebody is telling it is 1%, the 1% for our population is very high. So we need to protect each and every child from hepatitis A so that the child should not go to pulmonary hepatic failure.
Right. So, doctor, is there anybody like other than the children? You see any other population being affected from this? Whether it is maybe which age
Yes,
group you
yes,
feel
that is true.
being more affected? Yeah.
Usually, what happens? Hepatitis A is a waterborne disease, fecal-oral transmission. So
Yes.
unlikely, but happens. It happens. There are many literatures are there. Male to male sex, that is one of the most common source of infection. Then daycare centers, the hosteliers, the hostelites, the most important population, the travelers coming to endemic zones. We are in the medium or in the average endemicity of our country in the globally. So if somebody coming from US or UK to our place, then definitely he should be vaccinated against hepatitis A because we are in a higher endemic zone than their countries. So we need to take care of travelers. We need to take care of male to male sex type of habitual to habit having those type of persons, and in hosteliers, in the boarding, in the military canteen, in the military centers, barracks, where people are staying a lot of people are staying in a closed room. So that there are the possibilities of this spread of this vaccine by the fecal oral transmission.
So it's a very contagious disease. Like if one person get infected, it can infect how many people across? Like doctor, as per your experience.
No, if there is no such data, how many people will be infected. But the thing is that you need to take care of the community. Means if there's some persons are residing in a common place, there is a chance that your hand is contaminated. And if you are not taking proper sanitation hygiene of your hand, then you can touch other things and that thing will be contaminated and again that thing will be taken by the other people. So it's a chain. You need to break the chain by making the taking care of the personal hygiene, and that is the most important part. And after transmission also we have to protect the siblings. Supposing one person is affected in the family and we need to protect our sibling, that is also possible. Within 2 weeks we have to protect our kids by giving the inactivated hepatitis A vaccine.
So, doctor, another disease we know that is something called typhoid, which is also spread through contamination of food and water. So, like these kind of diseases, how do you recommend like hepatitis A and typhoid for the vaccination for the
Yes,
adolescents and adult group?
aspect again, typhoid is global disease that is not only limited to India, it is a global disease, and especially the South Asian countries like India, Pakistan, Afghanistan, these countries are most commonly affected, and mostly this is also a fecal-oral transmission. And this virus is a inoculum-based disease. Supposing typhoid, this bacteria, typhoid is caused by bacteria, not by virus. So what is happening? It is the Salmonella typhi. This is a inoculum-based. Supposing we are giving one vaccine, that may not be sufficient. The Indian Academy of Pediatrics recommend the vaccine at 6 to 9 months of age, single dose. But since there are no studies or literatures or many, not no studies, many studies have come out regarding the immunogenicity, waning of the immunogenicity after few years. So therefore, it is recommended by one-to-one individual aspect. If you see, then it is recommended to give the second dose at least at 4 to 5 years of age when the child is going to school or when the child is getting some exposure to outside food. So it is the same type of transmission, fecal-oral transmission, but the severity of typhoid fever is little bit more. You can say the common. It is more common than hepatitis A, and it is mostly 90% cases are can be prevented because we are staying in a country where many people, around 30 to 40% people, they are not getting safe sanitary water or they are
Water.
not getting safe water. So we need to take care of that. The water purification process. The most important is the hygienic part that need to take. But in the school, people are getting. If you go to a school, if one person is affected by the typhoid or hepatitis A, then in the next 2 3 days we get 4 5 cases of typhoid, 4 5 cases of hepatitis A. That happens because of the point source, and the point source should be controlled. That is the way you need to take care of, and the vaccination is utmost important. And in typhoid, you need to have a second dose definitely. In the recent future, also, I think Indian Academy of Pediatrics will come up with a second dose schedule of typhoid vaccine.
Okay. Doctor, is there a common myth like mostly people feel that vaccination should be restricted to only children? That's why adolescents and adult there is no vaccine. So, do you recommend this adolescents for adult vaccination hepatitis A, and if at all,
Yes.
and for whom and how this vaccination is recommended?
Definitely, it will be beneficial for adolescents and the adults also. But as for now, the IAP recommends that after 10 years of age, if in India, because we are in the endemic zone, so we are subclinically infected by hepatitis A, and we have some seroconversion in our body. So if we are getting some amount of antibodies in our body, then we can think that yes, that is the possibility that that person should not be vaccinated. Rather, that person should take care of personal hygiene. So the antibody level you do, and if you are subclinically infected and your antibody level is high, then you can take the precautions of only personal hygiene. Otherwise, if you want to take a personal opinion for one-to-one individual opinion, then it is highly endemic zone. So you should take at least two doses 6 months apart, which is ideal for till 65 years of age. There is no the worry in that. Till 65 years of age, we can get the vaccine.
Doctor, any thing common myth you'd like to discuss with the vaccination in terms of children and adolescents, which normally
Yes,
you do have a practice and parents come with so many myths which
many
needs to
many
be.
myths are there. There are many myths to the vaccines. People are telling that these vaccines won't work. We can have better things. So we can how this vaccine will prevent. There are a lot of vaccine, MMR vaccine, autism, still they are lying with the people. You get MMR, the child may become autistic. You get sometimes meningococcal vaccine, the child may develop neurological impairment. So that type of things are still happening. That type of still there, but it's now coming down because of the awareness of the patients as well as the awareness of the parents. It's been coming down, and doctors are little bit also counseling more for these patients. So myths are still there, but it is in the lower socioeconomic status and especially in the low education status people, but not in the educated mass.
Doctor, if you see, like as you said before, if you see in the past, we were exposed to various environmental factors and we were not taking care of hygiene. People are not knowing to take care of hygiene. Post COVID and prior to that also, what India has learned a lot of hygiene practices. So parents are teaching their child to how to remain best hygiene practices. They're also learning. So do you feel that a major population is not exposed to certain kind of virus and they need vaccine? Because what we are observing, there is a immunity gap and India is moving to intermediate state of epidemiology. So in that case, so you see that there is a lot of gap of children who are being actually being exposed during the child and they are not exposed now, and how this gap can be filled. Do you encourage something called catch
Yes,
up kind of vaccination?
actually, what happens is hygiene is a double-edged sword.
Yeah.
Supposing hygiene hypothesis concept is there, so if you take care of more of hygiene, people are there, the parents are there, everything they are touching, they are just pickling their hand with the hand shield or hand rub, and they're just keeping the child extremely hygienic, and that will
Yes.
cause another problem because that will create another problem for the child because the child won't be able to expose to any other antigens. So if the child is not able to expose a little bit of antigen, the antibody won't be developing. What is happening in India? We are staying in a place where we are every time we are getting outside food and little bit of antigen we are inserting, we are ingesting. So therefore, we are little bit immunogenic than those people who are coming from US or UK or Germany. These people are coming; they are extremely vulnerable for infection. So when they reach here, when they take outside water, little bit of antigen, even one antigen also can cause havoc disease in them. So definitely hygiene has a role, but not so much of hygiene because after COVID we have seen lot of cases of because so hygiene was so strict. People are coming up with enteric fever and everything because of ingestion of little bit amount of salmonella typhi. So that is true, but hygiene should be taken care of. But in endemicity zone, those who are going to a high endemic area, we need to take care that vaccine is a must because you do not know how much vaccine antigenic load you are getting in one exposure. So that should be taken care of. Hygiene along with the vaccine is the solution.
Doctor, you see that parents and adults proactively discuss preventive vaccines. with their physicians. Do you see that trend happening in India now? How are you
Yes,
observing?
yes,
Whether
it is definitely people are coming up, they are asking, and especially after the COVID, it has been increased a lot because the awareness of COVID vaccines has such a impact on the people mind that they are asking what vaccines are there. That happens to many patients, many, not to all, around 60-70% they are asking, sir, is there any vaccine which can be left out for my child, which I can give so that my child will be protected? So these are the things they are asking. But 30-40% people are also saying, denying, no, we do
yeah,
not require any vaccine. What happened? COVID has killed so many patients. What happened? So these are the things, myths are still persisting. But these will come down with years and together. But in my clinic, in my practice, I can say 60% of parents are educated, 60 to 70% parents, they are asking, what about the
yes.
vaccines left? Please allow us to give and explain about the vaccine and give it to us. So
So, doctor, you have been experienced long, like you have been experienced in the practice and all. So, you have seen like how vaccine has played a role in preventing or stopping certain diseases to occur. So, could you throw some light on it, like how it has
yes,
stored in the world and how?
already we are in the verge of elimination of polio. Polio already being eradicated in our country. Smallpox eradicated by the simple methods of vaccination, and we are in the pipeline of eliminating measles. Measles will be eliminated by 2030. It is expected time interval, and so also many things will be eliminated slowly. But the diseases which are having they related to hand hygiene issues like typhoid, hepatitis A, these won't be eliminated so rapidly because these are the sources to be controlled. Therefore, that those type of things will remain. But there are measles, respiratory, pneumococcal vaccine has got a tremendous role. Rotavirus is a vaccine that was developed a few years back in 2016-17.
Yes.
Now we are getting a very less number of rotavirus diarrhea. Since
Yeah.
10 years of implementation of the vaccine, the rotaviral diarrhea has come down drastically. Similarly, pneumococcal disease has also come down drastically. So gradually the vaccines are working and it is definitely has some impact on the global health. So I think this vaccination will have an impact and definitely few diseases will be eliminated also in the recent future.
So, doctor, as we now conclude, coming to the concluding of the session, so before we close, what should families know specifically about protecting all age groups about through hepatitis A vaccination, also including catch-up vaccination, and uh, how to maintaining high risk vaccination and long-term protection through vaccination. So, any message to the guardians here today?
Yes, definitely. First of all, the parents should note that what are the vaccinations available, they should consult to the nearest pediatrician or the available doctors. What are the different recommendation vaccines available? What is as per the National Immunization Schedule and as per SCVIP guideline, what are the vaccines that are available for they should know. Then they should consult individually to the doctors about his kid or her kid regarding what vaccine they can give and what is the affordability. In National Immunization Schedule has got a very good vaccination schedule for the children in India. Now pneumococcal vaccine is included, fractional IPV is included. So there are many vaccines. So we need to take care of that part also. That vaccination is there, but you need to take. Similarly, for IAP schedule also, if they want, if they afford, they can also take the vaccine. Regarding HPV vaccine, if adolescent girl is there, then we need to take care of adolescent vaccination schedule by 1 minute, 1 minute. Hey, Sila, 1 minute, Sila. 1 minute, automatically.
Yeah.
So, concluding remark is that you need to take care of the vaccine which is there available with us and which need to be taken care with special consideration. Supposing there is an adolescent girl and we
Yeah.
need to take care of the HPV vaccine and we need to take care that we need to know that what is the effect of this HPV vaccine. So the parents are not knowing the effect. Therefore, they should consult the doctor. If they take or do not take, that is their decision. But they should come and open discussion. They should go and see the pictures, movies, or the leaflets. That is the motto of today's nation. That vaccine should be taken or not to be taken depends upon the parent decision. Only thing is that after knowing the effect. Supposing Tdap booster is now a very important thing. Tdap in
Yeah.
pregnancy how much they know about the pregnancy immunization, the patient, the pregnant lady, or the relatives, how much they know that acellular pertussis will have an impact on their kid. And what is the impact of pertussis in the newborn? If the neonatal pertussis happens, what the seriousness of the child? If they will know, definitely India will have a day where TDAP will be introduced in the government, in the NIS schedule, also in the pregnancy. Similarly, the similar thing happens for which HPV is now introduced in the NIS. HPV is now introduced already. So
Yes,
many
yes.
states are. So we need to have that type of impactful messages, impactful media coverages, impactful WhatsApp or Insta coverage for the impact of the vaccine on the patient health condition. And I request Indian Immunological Limited should take further steps on this to have awareness among the parents and the population over the country by creating flyers, messages, all these things so that it will have some impact in this. So because this year World Immunization Week is vaccination for all ages. So
All
we should
ages.
take the leading that this vaccination coverage should be there for everyone in the country. And the impact of the vaccine should be much taken into consideration that yes, you take or do not take, but you know that this HPV vaccine has got 86% coverage, single dose has got this much of coverage, double dose has got this much of coverage. That type of awareness, person to person counseling will have definitely a boost on this immunization week. And thank you very much, everyone, for listening to this. I hope this type of messages definitely will be help for our viewers.
Thank you, Doctor. Actually, your message is very clear and clear to all of us here. Basically, gone are the days where actually vaccines are only restricted to the children or the kids. But if we go every stage and every age, we need to be protected. There are vaccines to protect at various stages, and it is very much clear that there are also certain vaccines where travelers should consider. There are certain vaccines given in pregnancy. There are certain vaccines for elderly also. So thank you so much, doctor, for being here with us today. Thank you all for being a part of Immunization Conclave. And we hope today's session was informative and valuable in spreading awareness on vaccinate and prevent hepatitis A protection for all age groups. Our special thanks to Dr. Mrutunjay from Bhubaneswar for sharing his time, expertise, and insights with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow the social media channels. Do share, like, spread the word to as many individuals or friends, family, and relatives. Until we meet in the next live talk, stay healthy, stay aware, and please do take good care of yourself. So thank you so much.